Great. Well, nice job assessing Peter. I think you were right on with your diagnosis there.
Thanks.
He's got a pretty good history for possible peptic ulcer disease, and his exam is reassuring against anything else more serious going on. So we should probably talk about that positive ELISA test that his primary care provider got for us and decide whether we think that that's an appropriate test or whether we should do something else. As we talked about, things are a little bit controversial in pediatric H. pylori infection. So did you have any luck finding that paper?
I did find the paper, actually, and it was right in the journal that you had said it would be in. And basically, well, the title is non-invasive testing for H. pylori in pediatrics. And what they did was they compared the stool antigen test to the serum ELISA test, so the two things that we're kind of looking at. They studied 250 patients, all of whom were kids aged 3 to 18 years. And the gold standard was a biopsy that they did with, via EGD to confirm that there was H. pylori present in these children. And so what we found was that with the serum ELISA test, there was a likelihood ratio of 4.52 that the patient that test would show that the patient had H. pylori. But with the fecal antigen test, the likelihood ratio is up to 50.6. So really a much stronger result with the fecal antigen test.
Absolutely.
So I think it's a really good paper. I think it's a good gold standard that they used.
Yeah, so it is important when we're looking at this kind of thing to make sure that we are comparing things to the gold standard, so that we know that our comparisons are helpful. So good. So this is what I remember the paper proving.
Yeah.
So why don't we go back, if you can talk to Peter and his mom about doing a fecal test and what that means with stool collection.
Okay.
And I will call the primary care provider and let him know what we found as well.
Okay. And then if his stool test comes back positive, we'll go ahead and treat him, won't we?
Definitely.
Great. Should I talk to him about treatment today or hold off until we have the test results?
Why don't you hold off, just
Okay.
because the treatment can be a little bit complicated.
Okay.
So we won't overburden them today.
Great.
Okay.
All right, I'll go talk to them. Thanks.
Okay.